Hi, I'm Dr. Kimberly Moore, host of the Envision More Workforce Insight podcast. Join us as we explore workforce and leadership through an innovation lens with leaders from across the country in every industry. Whether you're in education trying to crack the code for workforce or industry seeking to address your workforce talent strategy, or maybe you just need to be inspired, we've got you covered. Tune in, save us as a favorite, and let's innovate together. Thank you for tuning in to another episode of Workforce Insights, the go-to podcast for hearing from executives across the country, whether it's education, whether it's government, whether it's nonprofit, or even the private sector. They're all congregating right here to bring not only the insight, but also leadership perspective. And today is no different. I am so excited to have our guest here. And I think just to kind of level set with the audience, I'm going to say, to get us started, could you share with our listeners your education and career journey that's led to your role as president of Thermo Fisher Scientific, a globally recognized company? And I know that there was a recent retirement, so we get to benefit from all the insight that you bring.
Well, thank you, Dr. Moore. I'm so glad to be asked to be a part of your podcast publication here. And my journey started several years ago as a student at Florida A&M University, where you and I both sat on the board of trustees recently. And during that time, I majored in music. I went to school on a full music scholarship, and I minored in business. And one thing about music, I was a classical French horn player, still a classical French horn player. I have played a number of years, but music gave me a variety of understanding because of interpretation, and really, it really helped me when I moved into the business world, how to deal with complicated issues and listening and playing as an orchestra, playing as a team. My career also expanded over the number of years in that I've worked in 5 different industries. Started my career with Baxter Travelall out of college in the medical surgical industry. Then I went in the food service distribution industry with Kraft Food Service, which is now U.S. Food Service, the distribution arm. And then from there, I went into the office products business, Corporate Express. Staples acquired Corporate Express. It was a $26 billion conglomerate between the two companies. And then from there, I went into the MRO business, the industrial supply business with W.W. Grainger, where I became global vice president of Grainger and managed all of our contractual business around the world. And I thought I was done, but then I asked to join Thermo Fisher, the life sciences business. And I was in that business for 5 years in 2 president roles, one as president of Fisher Healthcare and one as president of all of our contractual corporate account business domestically and around the world. Very, very wonderful experiences in those 5 different industries. And in all those industries, I've had the pleasure of serving as either vice president or division president or global vice president.
I love this, Michael, and to our audience, the Michael DeVos, just amazing, rich history and how you were able to connect the dots with your experience at Florida Agricultural Mechanical University. We know the #1 HBCU in the nation, and
Yep.
through music and how you've been able to use that throughout your career. I mean, it's just so powerful. I mean, such a rich tapestry of just experiences. And I guess it's a great segue for if you would share insights, into the current landscape of workforce development within the life sciences industry, and particularly in light of, the recent technological advancements and shifts in the global market. What does that look like now?
Well, COVID was a big disruptor in the marketplace, not only here in the United States, but around the world. And when I was when I was serving as president of Fisher Healthcare, we were on the front lines of that, biological, phenomenon. And as a result, we went from 0 to 100 overnight. And it's disrupted a lot of things. It disrupted supply chains. It's disrupted even talent. You know, I served on before I retired, I served on the President Biden's task force commission of focused on biotechnology and biomanufacturing, and along with 11 other notable leaders to discuss the talent that is actually leaving the United States. When folks come to our shores, they go to our schools, they learn about our technology and our advances, but they leave and go back to their countries. A lot of them, like China and India and other countries around the world. So the task force was really brought together as a think tank to think about how do we keep that talent here in the United States? How do we make sure that manufacturing of biopharma production is all done here in the United States, and that drug development and mRNA formulas and drug therapies and all those things that come with the solutions to our world's problems around medicine stays here in the United States, and we continue to be the leader with that. I will tell you that STEM education is another big part of this, of embedding that in the lower levels of education. No longer is it something that we should be talking about in high school. We should be talking about it in elementary school, and we should talk about it in middle school, and embedding STEM programs to get our kids interested in the sciences and in math, and all the things that feed the technological research that's needed in order to bring about the solutions for medicine, both here and around the world. And then I think the other part that I think that has to change is workforce development from a diversity point of view. Um, as our country continues to evolve and change from a demographic point of view, it's important that medicines and solutions that we bring to the marketplace can affect everyone in our society, not just a particular sector. And while I was at Thermo Fisher, we have a clinical drug uh, trials business called PPD that we acquired. And that business really is focused on having a diversity of folks in the clinical trial, process. We can take, a drug from its formula all the way to production, all the way to clinical trials, and then bring that to marketplace with the scientists of the company that's bringing it out there as a manufacturer. So that diversity in our society, the diversity in how we look at medicine is important. And so the landscape in terms of the workforce has to be important because solutions, even to the solution that came out for COVID, came from a person of color. And
Wow.
so let's not forget that ideas and solutions can come from anybody, any scientist, any person from around the world. We just should not be segmented to one population at all.
I love because I know we have listeners now globally listening to the Workforce Insights podcast and hearing that conversation like never before, diversity of thought, diversity of experience, diversity of different perspectives. And so just so wonderful to be able to speak to that issue that STEM is critical. Workforce starts early. And the whole notion of it just being, I call it the single look, the single thought process is no longer the case. It has to be spread across everywhere and everyone being involved in the solution making. And I know Thermo Fisher Scientific, I mean, you're renowned for its innovative approaches and certainly through your leadership and the work that you've done. But how do you see, the role of innovation evolving, the shaping and future of workforce, both within the organization and even, I guess, broader outside of the life sciences community? What do you see with innovation?
Well, innovation and creativity kind of go hand in hand, and they are the keys to finding solutions to our scientific problems. Having a diverse approach, you'll also bring faster solutions to the market that can also help people with their various diseases. And we think about the speed that we brought the COVID vaccine to marketplace by the scientific community. It was done from a diversity point of view. It was done by innovation and it was done at a rapid pace. I mean, there are diseases that we've been working on for years that, we've got, band-aids for them, but to find a solution and bring it to market in such a quick period of time shows the appetite and the ability when all the sciences come together and all the smart minds come together to be able to bring the right solution in order to cure a disease or bring drug therapies in that can manage a disease in the marketplace. I talked a little bit about the clinical trials piece. You know,
Yes.
when you're developing these drugs from an mRNA formula, you want to make sure that they can affect the majority of the population, and the only way to do that is to have a diverse clinical trials group. And so, our thinking about innovation and creativity and having the brightest minds work on these problems has to be globally, not just domestic, but globally, because these diseases, as you know, spread across the world.
So again, the insight that you bring in, again, you referenced earlier our connection to Florida Agricultural Mechanical University, and I always remember your voice and advocacy related to workforce development and why it was so important. And I think our listeners get that as well, that it is something that we all have to be all hands on deck with. And you've also mentioned just the need for collaboration. So collaboration between industries, that's crucial as well. Could you elaborate on some of the strategies that when you were leading there at Thermo Fisher, some of those strategies that you all employed to foster successful partnerships with other sectors? What did that look like?
Well, I'll talk about two things. I'll talk about, in the business that I ran, Fisher Healthcare, and how it's important to have a very diverse supplier base because there were products and solutions that Thermo Fisher manufactured. About 40% of that came through my division. But there are other solutions that companies like Abbott and Siemens and other companies out there manufactured and produced. It also came through my business as well too. So, having that communication, having that partnership with them, to have the best in the lab in terms of testing and cutting edge testing that can, detect diseases and give the right diagnosis so that the medical community can come back with the right path forward. It's very, very important. And I'll give the other example, which is around Moderna and Pfizer. When you think about what happened with COVID, they came up with the solution. But Thermo Fisher was one of the manufacturers of that drug that brought it to the marketplace in a very short period of time. So the collaboration between the manufacturer, collaboration through distribution, is very, very important in doing things like that. So you can't work in a silo. You have to be able to work in as a community in order to bring these solutions to the marketplace. And we're all very competitive, and we all want to have take our share. But in serving mankind and in serving our nation and in serving the needs of our citizens in terms of a health perspective, the collaboration around the science has to be there because the end result is what we're looking for in order to serve mankind and to make sure that we manage those diseases that affect our society both here and around the world.
You're exactly right. And I know you really brought it home and made me think about an example. And if you could share with our listeners what you were successful at doing with Florida Agricultural Mechanical University, FAMU, around COVID and how what that impact was and how it even, went beyond just the university.
Well, I am very, very proud of my company, Thermo Fisher, that put their money where their mouth is and put their actions when they were needed to protect our community, in particular our HBCUs. Thermo Fisher, through the JUST program that was developed by the company, put aside over 25 plus $1 million in order to ensure that testing was available to the HBCUs around the country. Over 103 plus HBCUs. I think about 60% of them took advantage of that. And not only just the HBCU itself, but the community in which the HBCU was a part of. At Florida A&M University, we were to allocate over $2.5 million plus to the university, stood up a CLIA lab there at the university. And so those universities that did not have the ability to have a lab were able to send their test results or their tests into us, and then we could then turn it around and send it back to them digitally for those students to know or citizens to know, what their status was with the COVID disease. During that time of uncertainty, protecting our young people in particular was very, very important to us as trustees on the university board and to have that collaboration and to have these CLIA labs set up with the universities like Meharry Medical School and Florida A&M and others really was able to help during a time that was evolving, during a disease that was evolving, to at least know what the status was so people could protect themselves and protect others they may or may not have come in contact with. And then when the vaccine began to roll out again, having access to that too, helped protect a lot of our students around the country. But not only our students, but the community those schools are in. And I'll give you an example. There in Tallahassee, over 700,000 tests were done in
Wow.
the community as a result of the on-site testing at Florida A&M University. 700,000 tests were done
That's amazing.
time. So it's actions like that, it's collaboration like that, and I'm very, very proud of what Thermo Fisher as a company did in order to put forth the effort to protect our students. And that was just one of many things that the company did, but particularly around our HBCUs.
I love that. And I think, again, everything that you're mentioning really revolves around leadership. So, leadership plays a pivotal role in just driving organizational success. What leadership principles, I know the listeners want to know this, and strategies have you found most effective in navigating challenges and opportunities within the life sciences space?
Well, I will tell you that I have a very simplistic approach of leadership in that I put the leaders at the bottom of the totem pole, and I have put our customers, our colleagues, and our shareholders at the top because we serve our customers. And we also have to ensure that we have the best and brightest talent of our
Mhm.
colleagues and make sure they have an opportunity to really uh, expand their careers, reach their potential, remove the glass ceiling so that the cream can rise to the top. And then ultimately, those people that invest in our business are our shareholders. So they must get the return of that investment as well, too. So I look at it from a triangle point of view, and all sides of that triangle have to be evenly, focused. And if you put the customer, the shareholders, and the colleagues first, that's true leadership.
Right.
To see me out front. They need to see the business out front. Our customers, I tell my folks all the time, if you only have one customer, how would you treat them?
Right.
If you only had one customer, how would you treat them? And you would do everything for them. You
Yeah.
would beck and call. And so we can't let the number of customers that we have deter us from that spirit of service and deter us from treating every customer as if they were our only customer.
I think that speaks to why you have been successful throughout your career and the career even beyond that. So, because I'm certain there will be a 2.0 that we'll have to bring you back for, but I know that that has just shown through with all the leadership roles that you've had, and even with your service roles. Our time together again on the board. So, when I think about the Workforce Insights podcast, how it's described is really a focus on creating a winning culture within organizations. Can you discuss some of the key elements from your vantage point? And I know you talked about the triangle, and I know that folks were probably writing it down on their stickies. But from your advantage, or vantage point, that Thermo Fisher Scientific, the company culture that it maintained, how it contributed to workforce engagement. What did you all do to maintain that? What was the secret sauce?
Well, I think the first, I want to give a lot of credit to Mark Casper and the senior leadership team because they set the tone of what this culture has evolved to based on respect, encouragement, a sense of belonging, um, the processes that we practice as a business. Within Thermo Fisher is called PPI, but really it is a Six Sigma approach around practical process improvement, a business system. And what that does is try to solve every problem by understanding first what problem are we trying to solve, and then going through a very systematic way of understanding root cause, and then building out a solution, based on best in class and best practices that are out there, testing that before you just go full blown with that, and then bringing that type of solution that's tried and been tested and into the business to ensure that we do it right the first time. Every time you have to do something two and three and four times, it costs you money. So
Yes.
doing it right the first time and taking an opportunity to understand what problem we're trying to solve and making sure that the folks that we're solving it for, whether it be internal as a business in order to serve customers, because everything we do should be about how we drive customer excellence, customer intimacy in order to serve our customers, all has to be built around a systematic approach to doing that. And that's what lean thinking does. I remember when I was at Granger, Granger was very, very big on lean thinking. And matter of fact, all leaders had to have been educated on that. And that's how we solve problems. And so it carried over into Thermo Fisher, and it made me a better professional because we all have this sense of urgency to want to go out and solve the problem.
Right.
Throwing money at something that you shouldn't be throwing money at, or putting a whole lot of effort into something that really is not solving the problem, if you
Right.
have to identify what problem you're trying to solve.
I love that. And it really is a great segue to the next question because, I know that there are listeners that are at varying levels of their professional careers. And, it's going to be neat to know from you, what advice would you give to professionals looking to stay ahead in their careers, kind of amidst the rapid industry changes and advancements? What would that be?
Well, first of all, you need to take your head out of the sand sometimes and look at the world as it is. So understand the trends that's going on in your business. Understand the marketplace, understand customers' needs, understand the needs of your employees and how do you keep them engaged and how do you keep them wanting to stay so you don't have high turnover. So, these trends are very, very important, not just in the on the business side, but also outside of the walls of your organization, but internally as well too. And then be innovative and foster a atmosphere and environment well, people can bring their original self to work, their creative self to work. They don't have to change who they are when they come to work. And so, as leaders, as professionals, always reinvent yourselves. Never be satisfied with status quo. It's like the game of chess. I taught my son the game of chess early on when he was growing up because I thought it was a really, really good thinking game. And,
Right.
and some of the elements from that are always looking to be 2 to 3 moves ahead, anticipating the need. Translated into the business world, anticipating the needs of our customers, listening and talking to them, and then trying to bring the right solution that's going to help them operate their business, serve their patients in a more efficient way. And that's when you become intimate with them. And they know that you're part of their organization. You're not just a vendor or supplier, but you are an absolute partner with them. And not just saying the word partner, but that you anticipate their needs and bring that solution and ensure that they get what they need in order to serve their patients.
I love that. And honestly, I'm thinking, I was like, what, Michael would be a great commencement speaker because it really is everything out there in that audience that the young person, as they're preparing to enter the workforce, needs to know, and especially those that are in their careers as well. So, really good insight there. But then I'm wondering that someone must have played a key role in your own kind of leadership journey. So, what's the most important advice that you've received in your career, and how did it influence your leadership approach?
Well, never be afraid to try something different and new. Be open to change. Change is constant. Change is everywhere. Excuse me. And so you have to be open to change and not be just stuck in one way of doing something. I talked about the whole thing around, chess. Anticipate the need, ask questions, and listen more than you talk. And that's something that I had to learn over the years. And the more I listen, because a lot of times the solution can come from the most, you know, unassuming person
Right.
because either they've experienced something, they've heard something, and they may be the piece of the puzzle that you need in order to figure out this problem you're trying to solve. So listening and asking for feedback, be open to change, you know, um, anticipate the needs of those that you do business with. And as long as you put others first and think in terms of that as a leader,
Right.
you will have a great career, I believe.
Well, you know what? And you're a great example of that. I mean, that's exactly what you've had. So you mentioned earlier, and I'm going to go back to that one because I want the listeners to really appreciate this because you've lived it out in the organizations that you've worked for. So diversity is increasingly an important topic in workforce development, as we mentioned. How did Thermo Fisher Scientific or any of the other large names, global organizations that you work with, how do they prioritize that aspect of recruitment, retention, and advancement Because I know that's one of the big thing that, with so many different sectors that we're talking to, or at least listening to this podcast, they want to know, what's the magic for recruitment, retention, and advancement strategies, especially with diversity as your lens.
Well, I'll give you several examples here. I recently, stepped down as the chairman of the board of HIDA, which is the Health Industry Distributor Alliance, which represents about 130 healthcare companies. I represented them as chairman for a year in 2022, right after COVID, elected by my competitors of becoming chairman of the board. And during that time, we all collaborated together to work with Senator Burr out of North Carolina to get the Pandemic Act passed in Congress, which is lessons learned from COVID. But one of the other four pillars while I was the chairman was around diversifying the industry. We needed to create an opportunity here for more people of color, diverse ethnicities, backgrounds to come into the medical manufacturing and distribution segment of healthcare. Um, and as a result of that, we created a job board. And then we pushed that job board out to the universities, particularly the HBC, for them to see, what opportunities were available. Every company posted a job, but we had over 30,000 plus jobs that these kids never would have known anything about because of this job board that HIDA created. And it was a pilot program during my administration that I wanted to make sure, and Florida A&M was one of the universities that we first took it to. So now you have these students now getting this information that they had no idea was out there and available to them. And so you can't just go and talk the talk. You actually got to walk the walk. You got to put the information in front of people for them to see what the opportunity is or could be. And I think the other part around this whole the diversification has to start, go back to middle school, elementary school, about what the possibilities could be in medicine in the STEM environment. And we have to educate them because if you start planting those seeds at a very young age, then folks that want to be a nurse or want to be a pharmacist or want to be a doctor or want to be a lab technician or any of the other disciplines in medicine will get a feel and understanding what that's like and how they need to prepare themselves by the courses they take and by the things they get involved from an extracurricular activity point of view or a mentor that they may know of in church, in their community, on their street, next door, this doctor next door, they never thought to ask him about his career. You got to plant those seeds, which then helps curiosity grow, and then questions begin to be asked. I think internship programs are critical, for to feed this pipeline. And again, those internship programs doesn't have to start in college. My son is an attorney today, but guess what? He interned in a law firm when he was in high school.
Oh my goodness. Yeah.
Just doing gopher work there, but being in the environment to see what it was all about. And then I think building relationships with these folks early on. My company, I brought them to Florida A&M University for recruiting, but they have to start this recruiting and have learned they have to start at the freshman level. You can't wait for the juniors and seniors. They've already made up the decisions what they want to do and who they want to work for. So you got to start early. You got to get in with those programs, expose them to your organization, all aspects of your organization, whether it's accounting, whether it's distribution, whether it's in manufacturing, whether it's in finance, all of these different areas. Expose it. A lot of this is about exposure.
And you're right. I mean, regardless of whether it's an HBCU or just like you said, kid down the street or whatever the case may be, exposure is the way to go. I mean, when I think about, I've worked with younger kids, thinking about middle school, going out for different activities, and a lot of it is that they've never heard of these jobs, so they don't know what to aspire to. And now thinking about the space that we're in now with innovation, where a lot of the jobs haven't been created, but it's going to be a bunch of skills that you tie together that make up the work that you're doing. It matters. And again, I have never met a stronger advocate for not only youth, the workforce talent pipeline than you when I had the chance to serve with you on the board. So thank you. I love that passion, and everybody needs to hear that there are so many different ways that it can start. And it starts with each one of us. Everybody can play a role in doing that, sharing what you do with the kid next door. So when we think about all of this and looking ahead, what trends do you foresee shaping the future of workforce development and life sciences? And what efforts should industry just be undertaking right now? We talked about starting early, but what's on the horizon?
Well, I think one of the, I'll give you one example. One of the diseases that got really suppressed during COVID was cancer. You know, two things that kind of happened. People didn't go in and get tested. Uh, things were delayed, and cancer rates really have escalated during that period of time. I can tell you just in my own circle of friends, a couple have passed on because of, various forms of cancer. A lot more have gotten cancer, prostate cancer, uh, and others. And so when you don't get tested and you don't go in and have yourself evaluated on an annual basis, you're susceptible to things like this kind of sneaking up on you and getting the best of you. I think, what I see on the horizon is that, we need to create an environment where, getting checked out and taking care of yourself becomes the norm. Telemedicine is now coming to play, and telemedicine, it gives you an opportunity where if you don't want to go into the doctor's office, you can actually talk to them like you and I are talking and be
Yeah.
diagnosed and still have yourself checked out. So it has to be part of our society in terms of how we manage our own health. And what I see is, the availability to do that greater now going forward. That was a positive outcome of COVID. Uh, Telehealth and telemedicine, for your doctor to engage with you. They can actually see more patients by doing it this way. And I will also say that we need more doctors. And
Yes.
so, we've got to get more of our kids interested in the sciences to go to medical school and not be burdened with all this debt when they come out. So, how do we ensure that they can go to medical school, study, come out and become doctors in our communities? Because another thing that's going on right now is that rural hospitals are closing.
Yes.
So now people that live out outside of the major city are having to drive, an hour or two to get to a medical facility. Well, if you got an emergency, that's the problem.
Yes.
So we have to solve that by bringing medical care closer to the patient. We got to solve it by having this pipeline of students, based on this trend of how medicine is being served today. And we got to use technology and innovation in order to enable all of this to help make it happen. I hope that answers your question.
You did, and you touched on all those points that I've been reading about, whether it was rural healthcare and what happens there, and then I call it the root cause of that. Hey, you don't have enough doctors in the pipeline to even support all of that. So I also appreciate it because it could have gone a variety of different ways of conversation, but how you pointed it back to as much as we're advancing with technology, we, the humans, still have to make sure that we're at the center of taking care of ourselves.
That's right.
And so I appreciate that. That's wonderful. And I think, it's also why I saved all of the questions, and your responses were amazing, but I think this one's going to be the best one. The listeners want to know. I mean, I knew some of your history, didn't know all of it, but some of it. And now I'm like, oh my gosh, I should really have signed up for like this mentoring class or whatever. So tell the listeners, what's been the secret sauce for your success? Because yes, you talked about some lessons that you learned over time, but having a storied career like you've had and will continue to have, what stands out? I mean, regardless of where you are on that career journey, what stands out for you that were just absolutely critical milestones that played a pivotal role in who you are today?
Well, I have to give a lot of credit to my grandparents because they raised me in an environment where I sat at the dining room table on a Friday afternoon and doing book entries for their businesses as entrepreneurs. And I didn't even know I was doing bookkeeping and accounting at the time in sixth grade. But as they would pay the people that worked for them, I would make the journal entries into that. And then I was part of growing up in that environment, being raised by my grandparents, working and always having money in my pocket. But one of the things I saw most important in my grandparents that has carried over with me is that they were humble.
Yeah.
They were humble. They were giving. I mean, they gave to everybody that they could help. And they didn't worry about whether that person would take advantage of them or not because they had a spiritual connection that they were doing it from their hearts. And so that transpired with me, in a way that, I try to emulate that in all that I do. Number one, being humble. Number two, not making it about myself. Uh, Building great teams. And that's how my grandparents do. They had a very, very good team that was loyal and they took care of their teammates in their businesses, their families. And so when I manage people or have the responsibility to lead people, I want to make sure that I have that connection with them, that they're not a number. Like I was talking about earlier about you have a lot of customers and they just become a number. Well, you need to treat every last one of them like they're your only customer and you need to treat every one of your colleagues like they're your only colleague that's working for you. And hire the best talent and then giving them clear direction and then get out their way. And then allow the queen to rise to the top. Because if I'm the smartest person in the room, you're probably in the wrong room. Don't take myself that seriously. But what I have learned is to get the best talent and put them in the right situation and give them the right direction, allow them to give input in that direction because, again, I don't have all the answers. And so when you collectively get all the best ideas from people and you put that together, it takes your idea as a leader, it takes it to a whole other level because they're going to see things that you don't see. They're going to think about things that you hadn't thought about. And so that's why you want to let the collective really do what the collective can do and don't make it about yourself and your ego. That's got to be your idea. It's the collective's idea for in the best interest of the shareholders, of the customers, and of the colleagues. And when you do that, I found that to be very effective. And that's how you're able to accomplish your objectives year over year. And also have customer loyalty, shareholder loyalty, and colleague loyalty.
I don't think you could have said that better. And it's going to be the note, Workforce Insights listeners, that we end on. It has been an absolute pleasure sitting down with Michael DeVos, amazing leader, national, global, all of that and the above, just hearing his insights, learning more about life sciences. And Michael, please know that the virtual door is always open here at Workforce Insights Podcast, that you can join us. And for our listeners, thank you for being an important part of why this message is getting out. I would encourage you to, of course, like us, subscribe, and remember to share it with your friends. Until the next time, bye-bye. Thanks for tuning in to the Workforce Insight Podcast, powered by Envision More Consulting Group, where we bring your bold visions to life. Remember to subscribe, share, and stay tuned for more insights on navigating the world of workforce and leadership. Until the next time, be bold, be great, and let's innovate.